How are you?
Cool.
Hey, we have a question from somebody who's just signing on to the program, don't we? He wanted to know
Yes.
about setting a bite up. Okay, it's not what we're going to talk about tonight, but hey, we are here to help. So Mike, let's answer his question. Was he asking a question about? He's used a MyTap, right, for his wife?
Yep. He said, I finally got my wife's AHI and ODI to 4 and 5. How do
Hey,
you take a bite at this location? Hoping for a dream tap. She's currently in a MyTap.
good. Well, there's actually two ways you can go about this. One way is to leave her in the MyTap, but you take a Pro Gauge, which is a device that's available from Airway Technologies, and you kind of estimate where the incisal edges fall, set the Pro Gauge at that spot, and just simply take a recording there with bite registration material like Kettenbach's Futar material, according to the directions on the Pro Gauge. That's a super great way to do it, because then the MyTap stays with your wife while the Dream Tap is being fabricated. Another thing you can do is actually use the MyTap and just send that to the laboratory and say, mount the models with this, because it works right here. Now, the problem with that one is she doesn't have the MyTap while the Dream Tap's being fabricated. But both of those mechanisms will work just fine. Congratulations, by the way, on getting whatever she came from down to 4 or under 5 at least. That's excellent results. I'm sure she's feeling better.
Yeah. Yeah. Congratulations, Stan. That's awesome. And that's home team. I would, as the non-doctor here, I'm going to say, go with the first recommendation and not the latter, because if you take her appliance away, she's probably not going to be very happy with you.
Which makes me not very happy either. So, yeah. So in the interest of marital harmony, let's go with a Pro Gauge. Yeah.
Yeah. Hey, Steve, so we're at 5:01, 5:02, we're going to have a Pacific time, that is, you guys. I know you're logging in from a lot of different places tonight, so we appreciate your time. Let's spend maybe a minute or two max. Tell us the updates about the ADA, kiddos, and everything that's about breathing. What's going on there, Steve? You know the inside track.
You bet. Thank you for asking. On the 22nd and 23rd of April, we have our 4th ADA Children's Airway event. Now, it's critically important that we help our little kiddos grow up with nice big airways, so they don't end up like, the patients we need to do taps on. But still, we have that opportunity. And this time we have an amazing lineup of Sharon Moore on Thursday night. She's going to be zooming in from Australia, where she is going to lead us through myofunctional therapy, speech and language pathology, how it works in your practice, or how it works working with someone like herself. She wrote an incredible book called Sleep Wrecked Kids. And every dentist who treats little kids should have piles of those books in their office. On Friday morning, we have 2 pediatric dentists from Dallas who work together, and that's all they treat is airway issues for their little kiddos in Dallas. So they're going to talk about nasal clearing, like I'm going to talk about a little bit tonight, but for little ones. They're going to talk about communicating with their parents. They're going to talk about appliances they use. And then we have Sarush Zaghi, the preeminent expert in removing tethered oral tissues like lip ties and tongue ties, and why you should do that, and how do you work with a myofunctional therapist along that way. And then a very special event is Dr. Zaghi and his team are recruiting dentists to do clinical research. And they make it super simple. So you can do clinical research in your practice and be part of the solution, part of what changes little kids' airways for generations to come. So it's going to be an exciting event. It's very inexpensive. ada.org/CE Live. ada.org/CE Live. I hope we have tons of people on that event. We did in December. Let's do it again in April.
Awesome.
There you go.
Man, I had no idea that you had that whole thing already prepped. I mean, that sounds like an awesome course, guys. If you're interested in helping kids breathe better, which also tangentially helps their sleep patterns as well, definitely check that out. Support the cause. Our kids are worth it. And for those of us that have had kids that have suffered from apnea, I can tell you firsthand, it matters. So we appreciate it. Yeah. So ada.org/CE live, right, Steve?
That's it exactly.
Cool. Okay.
Yep.
So before we go any further, guys, I want to introduce this awesome speaker, lecturer, international phenomenon to you guys tonight. So Dr. Steve has been practicing and treating sleep apnea, obstructive sleep apnea, and snoring in the Bellevue, Washington area for a couple of weeks since 1988. He is a consultant to the ADA for sleep-related breathing disorders, trained at UCLA's mini residency, and is a current diplomat of the American Board of Dental Sleep Medicine. He lectures internationally, directs sleep education at Airway Technologies and the Pankey Institute, and he guest lectures at Spear, University of the Pacific, and Louisiana State Dental Schools. He teaches a lot, guys. So we're honored to have him here. He's also a past board member of the AADSM, and I won't steal the thunder, but you did co-author Quintessence handbook, clinician's handbook, pardon me, for dental sleep medicine. So I'll let you explain that here in a sec. But sure. Guys, we're honored to have Steve here. He's kind enough to give us his time, and without further ado, I want to hand it over to you, Steve. So
great.
Take it away.
Go. Let's start this up. There we are. And so this is what we're going to talk about, because my expertise starting in all those years ago was about making oral appliances for adults that breathe badly while they sleep. And so I'm pretty good at that by now after all this time. I like the appliances that I use. I like matching them with the patients. But what I also realized is that our impact is limited when we pull the lower jaw forward. We can make the tongue get out of the back of the airway. We can tighten up the tissues. But one of the things we always want to make sure we do is help our patients realize the value of breathing through their nose. So what I've got for you tonight is I've got 9 reasons why the nose is critical to making your oral appliances successful in managing your patients with obstructive sleep apnea. So it's not about the oral appliance, it's about the whole airway. It's about respiration, it's about breathing, it's about all of those things. And so we're going to go through 9 good reasons and give you some clinical tips, things you can use every day in your practice. When you talk to your patients, or when you suggest another therapy, when you consider what else could you do to make sure your airway therapy is successful for your adult patients. I'm very grateful for Awaken to Sleep, which is a fantastic way for you to learn about better ways to help your patients get through that, how to integrate it into your office systems, how to really make it work for you. Because when it works for you, it works for your patients. And when it works for your patients, they're going to breathe better at night, and they're going to be healthier. They're going to come back to you and say, wow, doc, thank you so much for talking to me about this thing I never expected to hear from the dental office. So Awaken to Sleep is a great way to do that, a great way to learn about that. And airway management, Dr. Keith Thornton invented the TAP appliances way back when. And Dr. Thornton and I have known each other for about 40 years now. And so he would reach out to his close people and say, man, Steve, you got to do more of this. This is exciting. And so I listened to that a long time ago, and so grateful for that. And Dr. Thornton has continued to mentor me along the way, and his company is Airway Management. So it's an enormous honor for me to be able to say that I'm the director of education for Airway Management. It thrills me to say that. Pankey Institute, I'm highly biased towards Pankey Institute. So if I say anything about Pankey, understand it's been part of my life since right after dental school graduation. And I think it's the best place for us to learn how to be great doctors, not just dentists, but doctors as well. And so it's a wonderful place. And we teach sleep education down at Pankey as well in a number of different forms. So if you want to learn about that, then go to pankey.org and see about that. I'm honored to be a presenter at some other places, and I'm advising several companies in the industry, actually. Glidewell's one of those, and some others. And so the key to it is that I think I have a way to orient us all towards what we can do best to help our patients from little kiddos on in through adulthood. the book is the only place you can go and take your money, put it in somebody else's pocket, and part of it ends up in my pocket. I got to tell you that for every book that is sold, Dr. Burley and I, my co-author, get to split $7.80. So I appreciate every $3.60, I think as it is, residual I get from that book. So please buy lots of books. So that's the only place that money's a direct thing for me. I'll talk about appliances, I'll talk about products, none of which is a commercial issue for me at all. So there's my disclosures. And so I'd like for Mike to pick up and tell us a little bit more about what Awaken to Sleep can do.
Well, I appreciate that, and I'm gonna we'll get to that, Steve, if that's okay. We'll table that for a little bit later.
Right.
No, I appreciate it though. I did want to tell you guys about the CEs. So this is an AGD PACE event. So we've got one CE offered to everybody who's attending. Eyes wide open, paying attention, because we can see you. Just kidding, but we do sincerely appreciate the time. At the end of the event tonight, we will post a link in the chat. If you click the link and fill out the survey, I promise it will only take you 32 to 41 seconds. 32 to 41 seconds, I'm telling you. At the end of that, you will immediately get your CE certificate emailed to you. If you don't click the link in the chat, that's okay. Within an hour after the event tonight, we're gonna go ahead and send you an email. It will have every link that we've discussed, including the survey link, and a couple of offers, both from Awaken to Sleep as well as airway management. So we wanna make sure that you guys have everything in one spot. That'll be in your inbox shortly after the webinar tonight. I will tell you, why am I on this webinar tonight? So Awaken to Sleep is the co-sponsor here. I had the blessing and pleasure of opening that business 5.5 years ago, and really truly feel like it's a calling. We want to help everybody in dental do great work with their teams and their patients. So if we can help you guys, we're happy to do it. That's why we put on events like this with great sponsors and great speakers. So I'm the founder dude, if you will, and I've been in sleep medicine for 18 years myself. I've seen a few patients get helped across that time, and I got to tell you, it's amazing to hear those stories. So that's what we live for, that's what we operate for. And CEs, again, stay on for the full hour, hit the link, you'll get an email, and I'm out. Go ahead, Steve.
Okay, very good. So here we are. Uh-oh, Chad, I see me, I don't see my slides again. I got to do, it worked in rehearsal, folks. So hang
Steve,
on.
we're good. We can see your slides. You can keep on going.
All right, there we go. Now it works. So guys, when we think about making oral appliances for our adult patients, that's what we're going to talk about tonight, is adult patients primarily. Tell them one little section here, but when we think about making our appliances for our patients, you know, it's just fantastic that every appliance we make, we put in place and the patients are so happy and they come back and, wow, it's fantastic. And man, we feel great, don't we? We think that we have the answer. We have created a solution for our patients that is just, you know, couldn't be beat, right? Is that how it works all the time? Well, sometimes it doesn't. They wear their appliance. They tell us about wearing their appliance, but gosh, their report back to us is that their bed partner, their whatever solution that they're looking for isn't really successful. They don't feel great. They don't like the appliance. There's something's wrong. It's not doing everything that we hope that they would do. So now we get depressed. We can say, wait a minute, what are we going to do? Do we think about another appliance? Do we think about advancing it more? Do we think about changing up the device for some reason? Uh-oh, do we think that we should send them back to CPAP just because they come back and say that it's not quite working? Well, I want to remind you about something. The American Dental Association defines dentistry as being responsible for the oral cavity, the teeth, the gums, the jaw joints, all the things that we all know we do every day. But did you realize that in addition to that definition, they talk about the rest of the oral of the body? They say that we're also responsible for adjacent and associated structures to the oral cavity and their effect on the rest of the human body. Really? So what's adjacent to the oral cavity? Well, we have the back of the throat, so we can look back there and make an assessment for the Mallampati that we know about if we've been trained in sleep medicine. We can look at the palatine tonsils. We can see if the uvula looks all beat up like a snorer's uvula often does. We can also ask them about breathing through the nose. That's an adjacent structure. Isn't the roof of the mouth the floor of the nose? Isn't breathing through the nose part of an airway therapy? Certainly it is. So if we consider the adjacent structure of the nose as part of our purview, now we can help our patients find a better pathway for breathing than through their mouth. Now, as dentists, of course, we don't want a mouth breathing because that dries out the tissue. It causes cavities. It exacerbates gum disease. It makes them feel terrible, all these bad things. But when we consider the value of respiration and properly done through the nose, it becomes even more important that we help our patients breathe through their nose. So it really is this phrase. It really is this plain. It really is this important that we help our patients breathe through their nose. So let's consider what the 9 things are we're going to do. Now we're going to go through these in detail, and I'll tell you about each one of them. But these are 9 good reasons for us to think about the nose. So let's think about this. One thing is we got to reconsider the airway. Remember, it's a 3D airway. Now we're used to looking at the mouth. We remember maybe our anatomy lessons from back in the day. And when I was in dental school, we did a whole head and neck anatomy lesson. We did gross anatomy a long, long time ago in my world. And I remember looking at the nose thinking, well, that's not teeth. Why should I care? In dental school, we have no context. But now we're going to be thinking about the nose. So we have to remember that 3D anatomy has a big effect on the flow of air into the lungs, the ultimate goal that we want to do. We understand, if we've been trained in sleep apnea, that we have a palate, we have a base of tongue that can close down the flexible oral pharynx. We can suck air into our lungs and cause a negative pressure that collapses the walls of those flexible tube we call the upper airway. But beyond that, we have a less flexible tube, a less flexible section, a part that doesn't change with pressure changes of respiration in the nose. That part of the upper airway is changes with tissue shape changes. That can happen in growth and development. It can happen in response to allergies. It can happen in disuse. There's a whole terminology called nasal disuse syndrome. So if you have patients who are habitually breathing through their mouth, they may not breathe through their nose just out of habit. They could breathe through their nose, but they don't. So we don't know why that would be, but one of the ways we can help our patients is to overcome a nasal disuse habit. Now, what happens if you don't use your nose, or if you have these chronic allergies, or you have some other reason why that changes? Well, there's a mucus lining of our nose. That makes sense. It's on that tissue. There's cilia on that mucus lining that move the mucus around so it doesn't drip out of our nose. It actually ends up swallowing it. Normal physiologic function. If you don't breathe through your nose, nasal disuse syndrome causes a change in the nature of that mucus. There's different cells that come around and become more prominent. So the mucus thickens up. Don't use your nose, the mucus thickens up. And if the mucus thickens up, the cilia don't work as well. The cilia don't work as well. They don't send the right signals along. I'll tell you about that in a minute. And they also don't move that mucus into our throats. And so it makes our airway less responsive. It makes it smaller. It makes it not able to clean the air the way it's supposed to. So we have to think 3D. We have to think about the anatomy up there in the nose. If it's been a while since you considered that anatomy, it's time to get the books out. Read a little bit about nasal physiology. I got to tell you guys, I am so thrilled to be invited to this lecture because I am a total nose geek. I love how the nose works. I've thoroughly enjoyed learning about that. I think it's critically important that we think about it. And so it's easy for me to study the nose, but for you guys, what you probably just need to do is remember what a turbinate is. Why does the nose function the way it functions? So think about the airway in 3 dimensions. don't consider just the oral pharynx to be your purview. Don't think about what your mandibular advancement devices do as the endpoint for making sure the airway is open. They're critically important, but there's even ways to make sure your mandibular advancement devices promote good nasal breathing. So they're part of the therapy. What else is there? This to me is the most interesting thing possible. Well, maybe not the most interesting. Anyway, it's really interesting to me. Here's the deal. We have the olfactory bulb. We all learned this in dental school, dental hygiene school, that's where we register what we smell. Okay, it's very important that way. But something else that comes up is there are specialized cilia all through the nasal cavity that report not to the part of our brains that interpret what we're smelling, but those signals report to the limbic system. So this is a diagram I pulled off the anatomy books that talks about limbic system structures. What's the limbic system? You know what that is. It's the hypothalamus. It's the amygdala. It's the thymus. It's the things that cause our brains to filter the kinds of signals that we get from the body, that we get from our senses, and sort them out into the right place in the cortex to interpret. For example, if you learn something, it goes into the amygdala, and then later the amygdala sorts out that memory and puts it in the right place for you to recall it later on. The hippocampus has a function that way too. If you get startled and you have fear, if you have a lot of emotions, that's part of the limbic system as well. So if we end up with a signal that's going to the limbic system from our nose, researchers have looked into, well, why is that? What does the limbic system need from our nose? Well, if we think about what the animal kingdom does, your dog, your cat, many other animals, they use their nose to assess their environment. And what most of those animals are doing is they're assessing for two things. Is what I'm smelling something I can eat, or is it going to try and eat me? That means that it's connected to the autonomic nervous system for survival. So if we breathe properly through our nose, the researchers are showing that it programs the limbic system to judge this area as safe. If we don't get that signal from our nose, then the limbic system goes into a heightened awareness state. So it up-regulates our sympathetic nervous system, makes us more likely to respond to pain, makes us less likely to remember things, makes us more likely to have a disruption in our breathing patterns. So nasal disuse syndrome also is limbic system disprogramming syndrome. It's not named that way, I just made that up. But what it does is it shows us that breathing through the nose is important for our brain health as well as every other part of our body. There you go. So that's something important I bet you hadn't thought of before. Now, the other thing that's really valuable about helping our patients understand how important breathing through their nose is it's really simple to have this conversation. It's easy for us to demonstrate to our patients what it's like to have a nice open airway or a closed airway. Now, I caution you that you don't ask your patients and expect a good answer to the question, well, how is it for breathing through your nose? Or is it easy to breathe through your nose? How are you do breathing through your nose? Everybody is used to the amount of work it requires to get air through their nose into their lungs. So as far as they know, it's fine. Now, sometimes your patients will tell you, oh, I can't breathe through one side or the other, or they'll tell you about like allergies and things and all the things that they do to fix that, all the problems that they have with chronic nasal congestion because of allergies. So that's important to know. And so you go through the history of, what kind of products are they using? Are they take medications? Is there something that's effective for them, something that didn't work? You get a good history that way. Here's something that's interesting you can do if you want to use a cool little video or a visual for them, is take one of your intraoral mirrors that you use to take pictures of the occlusion when you're restorative practice, put it in the refrigerator, put it in the freezer, and then bring it out and just put it under the nose and say, breathe out through your nose. And then you show them in a mirror how far the clouding goes. And if it's dramatically more on one side than the other side, well, that's a clue. That's a conversation piece. Is that scientifically important? Well, not so much, but you can use that in conjunction with your exam, with your history, with perhaps your cone beam x-ray that looks inside the nose. And you can say, wow, that left side just really doesn't work that well, does it? If that's the case for your patient. And they don't know that because they just breathe in. They don't think about left and right. But as you help your patients gather in the data that's critical for them, they will then in turn think more about that, and they'll come back to you and say, you know what? I realize when I lay down and I'm laying on my right side, I can't breathe very well at all. And you say, well, yeah, your left side's plugged all the time. And when you lay down on your right side, the tissues in the right side of your nose swell up. And so no wonder you can't breathe that well. So it's all really important information that you can use to talk to your patients and help them own their problems. One of the things that is really extra cool is your patients can benefit from some suggestions that you can provide them. We have some excellent resources in the marketplace about nasal breathing, about breathing in general now. And the top one is breath in the middle, James Nestor. James is a medical journalist. And what he did is he was actually studying free diving for another book he wrote. And as part of that, he had to learn how to hold his breath, how important the pattern of breathing was. So when he got through with that book, he continued his research and said, well, I need some breathing lessons. Took breathing classes. And the book Breath came out of that. You should read this. It's a wonderful story. It's an excellent way to learn more about that. James is actually being a very big supporter of dentists being involved in this. He's helping us at a number of different levels. Super nice guy. And he's busy, but he's also wanting to help us. Dr. Peter Catalano, an ENT physician, and Dr. John Walker, an orthodontist, got together and they wrote a wonderful book about adults and kids about nasal breathing. And it does very well at explaining nasal disuse syndrome and some other things like this. And then brand new, I mean, just released, the world's best breathing coach, Patrick McCown from Ireland, has just released his latest book. It's got 8 books before, called The Breathing Cure. Now, honestly, folks, I just got this in. I love Patrick McCown. I've read all of his other books. I own all of his other books. This one came in to me on Monday, so I can't wait to crack it and start reading it. It's a big book, but it's going to be thoroughly investigated and very practical. If it's like any of his other books. So you should read these for your practice, and you can hand out the smaller book, like Understanding Nasal Breathing, to some of your colleagues, your dentists that you want to refer to you perhaps. And any patient in your practice that's breathing badly that you want to help out, suggest that they pick up Breath. It's an excellent book. Have them go to their independent bookstore and buy Breath. Jeff Bezos does not need more of our money, and our local bookstores do. There's my little soapbox, sorry. So, Mike, you're back on. This is where you're supposed to talk about what's going on.
Yes, that's right. I love the Jeff Bezos crack, by the way, especially being that you're in Bellevue. I mean, it's just like, it's like saying, let's vote against the Seahawks, which I'm all for as a 49er fan, just saying.
Hey.
So, yeah, I don't want to take up too much time here, guys. There are 2 offers tonight. Airway Management has graciously given everybody who attends the course a free MyTap. So that appliance that Stan was mentioning, that is the chair side boil and bite that you can actually do right there, that he worked on or did for his wife, they're going to give that to you for free. So we'll have a certificate for that. Also, the courses that we've all been to that are a couple $1,000, bring your team, that kind of thing. Awaken to Sleep, our goal is to help people. So we have a significantly discounted course for you guys. It's going to be $297 for you and 14 members. There'll be $300 off coupon for that. I'll get out of the way. Steve, you keep going. We got great resources for you guys and your team.
Excellent. I want you to pay attention, guys, to that MyTap there. There's a difference in that MyTap versus the one I'm going to show you in just a little bit, because there's and it's a critical difference based on tonight's talk here. This is a cleaner picture, and you'll see what I'm talking about in just a moment. Thank you, Mike. So they breathe through their nose. what's the first thing you see when you look at their nose? Well, nares is one word for it. External nasal valve is the anatomic word for that. There's actually an internal nasal valve as well. You don't have to concern yourself with that one near so much, although that's affected by breathe right strips and these nose cone issues. So the external nasal valve is supported nicely in a couple of different ways. One is you can use a prop, and props take the form of these and many other ways to use this. Max Air nose cones are medical grade devices that are used actually in ENT offices after surgeries. Mutes, sleep right breathe aids, there's dozens of other supports in the market for your patients just to spread the external nasal valve. Now, there's a physics aspect to this, because if you open a space, then the flow of a fluid through that space changes to the fourth power of the radius of that space. What does that mean? That means if you open up the external nasal valve a little bit, then it's so much easier to breathe through that open space. And so your patients will immediately feel the difference if you give them one of these these devices, a Max Airs, a Mutes, breathe right strips, whatever you want to use. You can have your patients demonstrate that effectiveness by doing the Cottle maneuver on them. Now, you might remember what a Cottle maneuver is, but you can demonstrate on yourself right now. Take your fingers right about the middle of your nose and just simply spread sideways. Just pull your nose sideways. Take a breath. Notice how much easier it is to breathe through your nose when you can pull your nose open like that. That's the internal nasal valve, by the way. And if you can do this and your patient says, wow, that's way different. Well, then we have something we can do to help you with that. Breathe right strips work fine. The only problem with breathe right strips for a lot of patients is the glue starts to affect their nose, and so, or their skin over their nose, so they don't really like that. That's where Max Air nose cones came in, and the other ones to support it from the inside. It actually does a job on the internal nasal valve as well. Now, the rest of it comes with pressure changes. So I'm a giant fan of xylitol. I'm going to talk about that in just a minute. So we use a spray, a saline spray, not medication at this point. You can, but you can use a saline spray with xylitol in it to open up that external nasal valve just by changing the way the mucus lies around that valve and how the fluid flow of air works against that tissue. So my two favorites are Clear. It's a company that uses xylitol and saline, and then Neomed is another company that has a lot of products that we can use for kids and adults, and they have a xylitol rinse, and they also have a xylitol spray. So you can go to Neomed and you can look at those and see which ones might work for you. And those are both generally available at the biggest pharmacies as well. You can also order them online. So helping your patients change an anatomic defect. One thing you can use to test them, and I can't demonstrate for you, is if you can have them close their mouth and sniff through their nose. Well, there's an external nasii muscle that keeps the nasal valve open in the presence of negative pressure, unless it doesn't. And so you can have patients that can collapse their nose just by sniffing in. Most patients, the muscle expands the nose in response to that pressure change. Sometimes it doesn't work and it just collapses the nose. Those people can really benefit from an external nasal valve support. Inside the nose, in that mucus, is a microbiome. No surprise there. But what we use xylitol for inside the nose is different than what we use it for in the mouth, and it's different than what we use it for in the kitchen. In the kitchen, it's a sweetener. In the mouth, it has a similar effect to the nose. It helps us fight cavities. How does it do that? It changes the adhesive ability of strep pneumoniae in the nose and strep mutans in both places. And those bacteria are the ones that help cause reactions in tissues or sugar production in the mouth. So if we make the bacteria less adhesive, they can't form the kind of colonies that change the tissues or allow the byproducts of bacterial function to produce acids to attack the teeth. So xylitol rinses in the mouth, xylitol toothpaste, xylitol intake, xylitol sprays in the nose, change the microbiome over time, and doesn't hurt anything. And we allow our patients to have an easier time of controlling things they don't think about. What does that mucus look like? It does also enhance immunity in the nose. And so your patients with a lot of allergies, they can benefit from a simple xylitol rinse. You can also use medications here. So you can prescribe powerful medications. You can tell them to go to Costco and get generic Flonase or generic Nasacort. So simple little steroids. You can either prescribe or you can have them go just pick it up off the shelf and use it to decrease the kind of response in the nose that causes the mucus to thicken up or the tissues to respond and swell up. So all of those are tools that you can use to make sure that it's easier and easier to breathe through the nose. But what if we can't get everything done? What if there's a soft tissue part that needs to be changed? What if there's a relatively hard tissue part like the nasal septum? You might discover, taking a cone beam, that the nasal septum is bent over to one side. You're going to see this a lot in your sleep patients as adults. Why? Because the kinds of people that get diagnosed for sleep apnea are commonly folks with a structural defect of their cranial facial respiratory complex. Long words saying the bony support of the soft and hard tissues that surround our airway. If the maxilla is narrow because of all the reasons it gets narrow, then the roof of the palate goes up. When the roof of the palate goes up, then the middle of the nose, as it's growing in, doesn't have enough space to make that totally right. Okay. And so if the middle of the nose is squished right here, then the septum has no place to go except sideways. And so it bends over to one side or the other. There can be other things that go on. You're not going to fix that with a nose cone. You're not going to fix that with a xylitol spray. So if you discover that your patients are not successful in getting their airway open, and in conjunction with your 3D evaluation, either looking up in the nose or using a cone beam, then that there is a structural problem that only the otolaryngologist can change, then you need to find an otolaryngologist. Well, they are on our side. They are not sleep physicians, most of them, there's a few. What they do understand is that their role in helping people breathe is very similar to ours. Neither one of us diagnose sleep-related breathing disorders. They can, we can't. But what they tend to do is say, look, we can't fix sleep apnea with a septum surgery, not even a palate surgery. We can rarely correct fully sleep apnea, but we can make all the other treatments go better. So we can make oral appliances work better. We can make CPAPs work better. We can make all kinds of things work better. And of course, they do the Inspire implant surgery as well, a different subject to talk about. But if we have our patients who are struggling with nasal breathing, and we know that there's an anatomic problem, and the simple non-invasive things we've tried, like our oral appliances, like our Breathe Right strips, like our saline sprays, aren't really working, well, now it's time to send them to an airway-oriented otolaryngologist. Most of them know about this, but not all of them are understanding about oral appliances or the other things that we've done. So reach out in your community, find an otolaryngologist and start talking with them about sending patients to them about this. And by the way, can I help you understand, or is there questions you have about using mandibular advancement devices to open the airway for sleep-related breathing disorders? And you'll find some that are quite interested in being partners with you. They turn out to be fantastic partners, much more so than I have found sleep physicians. I like sleep physicians just fine, but otolaryngologists, we're working together. We're kind of on the same side. And so it's a good partnership to have, and it's actually quite necessary in any practice that's going to treat any form of sleep-related breathing disorder. I can't not talk about kids, because when these patients grow up, if they haven't formed good habits of breathing through their nose, well, then it's going to be tough to overcome. We use our myofunctional therapist partners for some of this. And if the kids have bad habits as little ones, while those bones are growing, then that bone is not going to be shaped correctly. I mentioned the maxilla can be too narrow. This comes from mouth breathing. So as you are working with your adult patients to make sure they're breathing well, talk to them about whether they have little kids in the single digit ages. If they do, then those bones that surround the airway in the mouth, the craniofacial respiratory complex, according to Kevin Boyd, those little bones are being formed. They're being shaped by habits. They're being shaped by how the child uses their nose, how they use their tongue, how they use their lips, how they swallow, how they bite. All the things that happen are all influences on how that maxilla is shaped. And the maxilla drives that airway complex. The mandible follows along, but we got to get the maxilla in the right spot. So if you're going to be a airway doctor, if you're going to help your adult patients with mandibular advancement devices, if you're going to make sure that you're paying attention to noses, you also have to make sure that the little ones in your circles, whether you treat them or whether you just talk about them to their parents, make sure that they're breathing through their nose all of the time. Little kids should never breathe through their mouth. Now, if they have a cold, sure. If they have an allergy, yes, but let's make sure the allergy gets addressed. It's because it's critically important that that nose breathing creates the right kind of pathways in the limbic system, creates the right kind of pathways in the shape of the maxilla as it grows in. So these are terrible, these are pictures of kids at risk. All these kids, I don't care what else is happening to them, they're at risk for having problems just based on how they breathe. Now, combination therapy is sometimes what it takes to make this all happen. So I told you to pay attention to the MyTap in the other picture. Look at the MyTap here. Do you notice the difference? Do you see something else that's on that MyTap? That MyTap has a silicone cover. It covers the stick that's out front, which is the adjuster section of the MyTap if you're unfamiliar. And it goes under the lips. It's really hard to take a picture of a clear silicone thing on a white background, guys. Sorry about that. And so what you can pick up from this picture is that there's a silicone flange that goes in front of the MyTap. I love MyTaps. I've loved MyTaps ever since Dr. Thornton invented MyTaps. I think they're fantastic for a lot of reasons. When he came up with a silicone cover that goes under the lips and blocks off the mouth as a vector for breathing, I thought this was genius because it makes everybody into an obligate nose breather. So with a MyTap, you can help them with a mandibular advancement position because it's a in your office precision made customized device. And then so they can move their jaw forward, but then you can add the silicone cover and make sure they're a nose breather, and you get to test many different vectors for therapy all at one time. The other thing that you can use is that the Airway Technologies can supply is a tap pap. So sometimes CPAPs are just necessary. The patient needs it to keep the airway open. Nothing wrong with that. I love CPAPs if they would work for everybody. So what Dr. Thornton came up with is the tap pap, and you can make this a couple different ways. You can have it where you mold what looks like the top of a MyTap, and it connects to nasal pillows. Here's our nose again. So you can help your patient have a non-movable nasal breathing interface for their CPAP. Many times they come in and say, well, you know, CPAP makes me feel better when I keep the thing on, but it moves around my face. Well, the combination therapy of a forward jaw position and nasal pillows like this can be magic for that particular patient. So you should have that as a means of helping. Not everybody's going to need this, but they can. The other thing you can do is you can use something like a MyTap, and you can put that underneath a full face mask of their CPAP, and that can also oftentimes make a big difference. Unlike really any other type of interim device, that silicone shield keeps the pressure from a CPAP from poofing out through the mouth. another common complaint of CPAPs. So if you have your patient who says, I'm okay with my CPAP, my nasal mask, but my air escapes from my mouth, it dries out my mouth, makes a lot of noise, just make them a MyTap and put a silicone cover there, and you'll be golden and a hero, and they get their airway open and they love it, and they feel they love you because you gave them a solution for their problem. Because really, it never really is just one therapy. It's always a combination of therapy. You always have to consider that the nose is for breathing and the mouth is for the other stuff. And when you can convince your patients that that's the actual thing that they need to do, then you're going to be a hero for them because they'll feel great. And you're also going to be a good doctor because you're paying attention to not just the dentist things we're trained in, but you're also paying attention to the medical things that affect the tissues next door, the tissues that we're responsible for, the tissues that we have as part of our overall scope of practice. And so that's really important that we consider that this combination therapy is what's necessary. Now, I want to tell you a little bit about the benefits of the TAP sleep care system. This is a bit of the commercial side of things, but it's really about how you can be effective here. And so the value of the TAP system is, like I said, you have these silicone covers. That mouth shield option is the magic of these things. It's the nose breathing enhancement. But it also goes along with some other major benefits. When you have your patients with their jaws forward, they don't want to be locked into one place. They don't want to have to worry about, can they move their jaw joint bones and TM joints need to move a little bit. So my patients really enjoy having the ability to just kind of hang their lower jaw forward on a hook like the TAP system gives them. They can move left and right from side to side. You don't have to worry about uneven advancements. It's kind of an unlimited amount of advancement, so you can really titrate your patients in just fine for this. So that midline traction, that midline pull is just a big advantage for you to be able to provide precision medicine for your patients. It gives you a chance to be very, very flexible. You can take any of the TAP system products, MyTap, DreamTap, TAP3, and you can add a silicone cover to the front of any of them. There's no other appliance on the marketplace that allows you to seal up the mouth with a removable, soft, easy to modify, super easy to keep clean and healthy silicone cover that makes your patient a nose breather. That's unique. And so powerful. If you want to make your patients breathe through their nose, make them breathe through their nose. And the other thing we tell patients all the time is the more you breathe through your nose, the better you breathe through your nose. And that's physiologic. When you breathe well through your nose, the tissue response changes, the mucus changes, and the cilia work. And now we have an open, clearer airway passage. It's what our bodies are meant to do. So if we do that properly, we have our patients quite super successful in making sure they can breathe well through their nose. So Mike, let's answer some questions. You there?
I am.
Hey.
Yes. My mic just came back on. Pardon the pun. We have a lot of questions.
Okay.
So I'm gonna run through them as quick as I can. Thank you guys for being interactive tonight. And Steve, I don't know if you saw me, but I hopped in there a couple of slides ago, and then you moved on before I could get it out. So the first question is, with the MyTap and the combination therapy with CPAP, with a full face mask, do you need to trim the MyTap? Can you trim the little post that comes out, or can you just wear the MyTap and wear the full face on top of it?
Well, generally there's room in a full face mask in front of the lips for the patient to be able to be comfortable so the lips don't run into the mask. So oftentimes if you're using the MyTap, you have to trim the post way back to where the little nut is. And so you do have to trim it back oftentimes, yeah.
Okay, great. And then the next question was about the mouth shields. So you ran through that really quick. I know you can use them with more than just the MyTap. Could you give us that list of appliances that you can use them with?
Sure, the DreamTap and the TAP3, the full-on custom devices that are available from Airway Technologies. airway labs, and you know, and their lab partners as well. But the TAP 3 and the Dream Tap have an anterior midline hook, and that hook is fixed in place with two little tiny screws. Well, they came up with a genius thing. You take out those two little tiny screws, screw in two other little tiny posts, and the silicone cover, which is the mouth shield, just snaps over the top of those posts. And so it's super easy for a patient to go back and forth as they get used to breathing through their nose. So they can put the shield in, breathe through their nose. If they feel like it's a little too much for tonight, they just pop it right back out. Easy to do, back and forth.
Got it. Cool. So another one, you had talked about using mouth tape. We got a few different questions. I'm going to try to summarize them. So first one is, what brand, and is Somnifix a recommended brand to you? So I'll let you do that one first.
Sure. We just use real simple 3M's micropore paper tape. We get it, costs about 75 cents a roll from some company that, you know, is popular to order from online. And so you can get it in boxes that way. 3M's micropore paper tape, 3/4 inch or 1 inch, works really well. You can get it 2 inch if you want to cover the whole mouth, it's fine. Somnifix is great. They just kind of pre-cut it for you. Works really well, but it's not a dissimilar product, and just weigh out the cost. We actually get those rolls of 3M micropore tape and just hand them out to patients because it costs us so little to make that happen. So there's nothing wrong with lip tape. If you're using an appliance that doesn't have a mouth shield option, then lip tape is fantastic to use. You show them how to use it and how you do that. If you haven't seen this before, I don't have one to show you, but a little piece of tape and fold over the ends, and so it's got a non-sticky end, and they put it vertically, they can put it horizontally, whichever works for them. And that way, with that non-sticky end, they can just grab it and peel it off anytime they want, so they feel less tied in, less insecure about that.
Got it. And what's the youngest age that you would recommend mouth taping? Do you use that for pediatric patients or only adults?
Well, I get to deflect that question by saying I don't see little kids in my practice, but my pediatric, if I did, and my pediatric colleagues, they carefully instruct the parents about what can be done about that. And it's the parents that have to decide if they're comfortable or not. Now, there's never been a cause of any kind of hurt of any kid using lip tape. And so I doubt if there's any risk factors there, but you're not going to be able to do anything until you convince mom that it's really worth the effort. So really got to get mom lip taping first. And there's actually whole families out there that everybody lip tapes. One of my pediatric dentists is talking in Chicago. She and her whole family, nasal clear and lip tape all the time.
That sounds like a really good road trip rule about the like 4 or 5 hour mark when people are starting to get cranky. You know, everybody's going to take a nap. We're going to lip
Everybody
tape.
practice their lip taping now. That's right.
Yeah, fringe benefit. Okay, so another question, completely separate from mouth taping. How can we ensure sufficient nasal patency for OIT patients, oral appliance therapy patients, and what are some of the definite signs of mouth breathing?
Yeah, sure. So how do you ensure complete nasal patency? Well, actually, you don't have to worry too much about that because the body automatically adjusts the effort of the diaphragm and the breathing muscles to pull the air through the space that it's given. So in other words, if you have a small space, it'll work harder. When it works harder, unfortunately, it also has more negative pressure and collapses the flexible parts more vigorously. So the more you open the nasal airway, the better they're going to breathe. So so you don't have to coach them on this, although breathing exercise may be helpful later on. What we want to think about is what was the other side of that question, Mike? It was nasal patency, and so you help nasal patency with the sprays, with the supports like the Max Air nose cones or the Breathe Right strips or those kind of things. How you help nasal patency.
Yeah, and the second part was signs of mouth breathing.
Oh, yes, thank you. Signs of mouth breathing. Well, I tell you a story. I saw these little kids in my practice when I was a restorative dentist, and I remember telling little kids, wow, how do you not brush your upper front teeth gums and let them get that red and swollen looking? when all your back teeth gums look fine. So I assumed they weren't brushing their teeth. Well, that's not the case. If you see a child or an adult with bright red maxillary anterior gums, they are mouth breathing. If they tell you about dry mouth, now that's caused by a lot of things like medications, but if they are mouth breathers at nighttime, their mouth will be super dry. And so it's really just a history. What do you observe? If they have a lot of wear on their teeth, they may be tooth grinders, but dry mouths wear down teeth hugely faster than wet mouths do.
Got it. And then on the note of the nasal sprays, Amy asked, can a neti pot be used in place of a saline spray, and how often would you recommend that it be used?
Sure. There's a lot of people in my practice that use a neti pot daily, just before bedtime. So Neomed, for example, they have neti pots, the little pour-in ones, little pots look like a teapot, and you pour it in your nose. They also have squeeze bottles, and so does Clear, actually. So those two companies both have squeeze bottles, and I like them better. So I recommend that people do that every day. My friend Todd says, look, we clean every other orifice of our body. How come we don't clean our nose? And so if we clean our nose with a simple saline spray and get in that habit, it becomes super easy. It's nothing to do. And with the xylitol, it even has a little bit of a sweet flavor to it. So it becomes just a routine. Yeah,
Got it.
And squeeze bottles are easy.
Yeah, and I'll add a personal aside to that. I use a Hydro Pulse.
Oh,
So
yeah.
if you don't like the squeeze bottles, you can, a little bit more expensive than the squeeze bottles, but it'll do the job. It's like the Binford 5000 from Tool Time. If anybody's on here that remembers that, it's got a motor. It'll shoot the water up, and it's really good. Just make sure you're over the sink for sure.
The water pick for your nose is what it is.
Yeah, that's exactly it. Okay, so it is 5:56 Pacific. So we're about 4 minutes from the hour. We're past the 55-minute mark to get you guys your CE certificate. So I want to let you know we're going to put that in the chat. We do, before we close here, we want to tell you guys about the two offers that are available to everybody who's attended. And we'll get back to these list of questions because I've got still got quite a few. We'll stay here as long as you guys will, but we'd like to get that stuff to you. Steve, could you move that guy forward?
I'd love to, but it's clicking at me here. Chad, may need your help. Try it again. There it goes. There it is.
Cool.
I had to start and stop again. Yeah.
Yeah, so guys, the first one that I referenced earlier, we at Awaken to Sleep, we do a course. It's not the same course that you've been to if you haven't been to ours. The difference is just right out of the gate, we're going to focus on the team implementation. There's a lot of great courses out there that do that. We are going to hyper focus on soft skills, verbiage techniques, and how you talk to patients. When you exit the course, you're going to actually know, and the team will know, how to screen patients, talk to them about the treatment plan, and actually get yeses. It's highly interactive. We limit the class size, and we currently only have 11 spots left for this course. Now that's coming up in just a couple of weeks, so March 19th and 20th. It's a Friday, Saturday. We do it live on Zoom, so it's a virtual platform. Cameras are on, mics are on. We highly recommend that you bring your team. 4 team members plus you as a doctor get to come for $300. If I'm going to be honest with you guys, you know, I love the course because we put it on. So there's my bias. It's $300.
What are the hours? Is it all day, both days, or what are the hours for that?
It's all day, both days. So it's 8 a.m. to 4 p.m. Pacific. Everybody that attends gets 14 CEs.
14 CEs for $300.
Yeah. We're trying to make it stupid simple. Guys, if you're thinking about it and you want a ticket for $300, buy the March ticket. And if, God forbid, something happens, you got to move your course date, we're flexible. We'll help you move it. It's a non-issue. We want to help. And if we can help your team go help patients, that's what we do for a living. So we're delighted to do it. The next offer, oh, what was that, Steve?
No, it just looks incredible to me. I teach courses like this, not yours. I teach other courses, and none of my sponsors have that kind of bargain. So good for you.
Thank you, man.
Well,
I
I shouldn't say
appreciate
that because I teach for Airway Technologies. Oops. Sorry, Charles.
it. So the free MyTap, you guys, as I mentioned, Airway Management is giving everybody who attended a free MyTap. The way you get that is the email that you get after the webinar. Click the link, submit your form. Everybody who attends tonight gets this form. Everybody who submits the form gets a free MyTap. Don't skip the middle part. Make sure you fill this out. They got to know where to ship it to you guys. So fill it out, and they'd be happy to send it your way. And you won't regret it. Try it out on yourself and see how it works, and then you can get some more and hand them out to your patients chairside. It's a great tool.
And you may be worried, well, what do I do when I get a MyTap? How do I make it fit? Well, Airway Technologies has videos that make it super clear. It's easy to make the MyTap fit. And if you have any trouble, just get in touch with Airway Technologies, and they'll put you in touch with me, and we'll walk through it with you. So you need boiling water is all you need. My staff and I went to Guatemala a few years ago with 250 MyTaps. So they were donated, and we did 93 of these in like a day and a half. So it takes about 20 minutes per MyTap. And so, yeah, and it's straightforward. It's a high quality, professional level device. It's not too challenging to make go, but there are a few things. So go to Airway Technologies, watch the videos that I put on there, make sure that you pick up on a few tips, and then try it out. And the best news for you about MyTaps, if you mess it up completely and you think, oh my gosh, I've ruined my free MyTap, you haven't. All you have to do is put the MyTap that you thought you ruined in boiling water, and it becomes like new again. It's magic. So it's a zero risk. Make sure you get your MyTap. Use it on yourself. Use it on your bed partner. Use it on your team member, somebody, and you'll start to reap the benefits of helping people breathe through their nose and with a jaw forward position.
Got it. Hey, Steve, I skipped something.
Oh.
Novel. Could you go back one slide? We got a question about the link that I didn't mention that's on the bottom, and the expiration. So anybody who wants to get a ticket for this course for the $300, the discount, go to Awaken2Sleep, that's the number 2, awaken2sleep.com/events. And that offer is good until the tickets are gone, or Friday at 11:59 p.m. So this Friday, a couple of days from now, you guys can make your decision if there's any tickets left, but go ahead and submit those or register for that by Friday. Otherwise, it goes back to the normal fee.
And you don't have to register for the course to get a free MyTap. Everybody gets a free MyTap.
That's right. Yep. Submit the form, and you guys will get a free MyTap. If you want the course, go to that website, and the link will also be in the email that gets sent to you guys tonight. So on that note, let's transition back to the questions, Steve, because we still do have some more. You guys, if you want to hang out, we'd love to keep you here. If you need to get going, we totally understand. One of the questions is, can an ENT diagnose sleep apnea on a sleep study?
Yes, they can. Their license allows them to do that. Now, there are a few EMTs that are board certified in sleep medicine. They've taken the other fellowship as well. The only problem that ever comes up, and it rarely ever comes up, is if you have an insurance company that's so restrictive that they require a board certified sleep physician to do that. Medicare is one of those. And so the ENTs are going to be of varying levels of comfort with that. Usually the only ones that will do a diagnosis, they already know that they're trained. So it's not a question in your mind. It's just a question of when you come talk to the ENTs.
Yep, exactly. Next one is, can you use both xylitol and a steroid together?
Absolutely, two different functions. So what I recommend is that the patients use the steroids not at bedtime, because the steroids have a different effect, and they affect 24/7 based on it's not really a surface effect, let's say it that way. And the rinses are a surface effect. And so in other words, I don't put the the Flonase in and then squirt saline in and rinse it all out. Don't do that. But you can do Flonase an hour before bedtime and then the saline just before bedtime. I do like the saline spray just before they go to sleep because it lubricates all the tissues nicely.
Got
or
it.
the neti pot or the squeeze bottle, whatever you're doing that way.
Got it. Stan hopped back on and he said, hey, thank you so much. His wife started with an AHI of 15. He was the first one that got her down to a 4 with the MyTap. So that's awesome news, Stan.
Good news, Stan. Congratulations.
What is your opinion about the Navarre or Navarre?
Navarre. Not sure I know what that means. Navarre.
Navage. It was a typo. Navage.
Navage. Don't know what that is either. If that's another rinse, then all rinses are good as long as they're saline. By the way, I didn't say this earlier. Make sure that your patients use distilled water or boiled water in their neti pots or their squeeze bottles. Critically important. We actually had a patient, not my patient, a woman in Seattle 2 years ago who died because she used tap water and got an infection. So if Navage is some kind of a mechanism or like a squeeze bottle, fine. You know, whatever you want to use to keep the nose open is good. Sorry, awesome. I don't know the answer to that one.
No, it's good. MyTaps, how much do they cost?
Oh, put $100 in your head. You know, it's about that much, plus or minus, depending on how many you buy, I think.
Yep. I thought they were $99 plus shipping or something like that. Yeah. Cool. Could you, I know you went over it on one of the last slides, but somebody's asking about multiple different appliances, the push versus the pull, the fin versus the anterior screw. Could you hit that again real quick?
Sure. And the answer I always like to preface a question like that is that what's my favorite appliance? And my favorite appliance is always the one the patient's going to accept and use. So a few years ago, I had a day where I was sitting in my office and somebody came in and said, well, I've heard about these oral appliances and I've heard that there's one that will keep my mouth shut. Because with my CPAP, I have to use a chin strap. I don't want to use a chin strap. Do you have an oral appliance that will keep my mouth shut? And I said, well, as a matter of fact, I do. And I have a tap appliance. Let me show you this little hook mechanism here. Somebody else came in and says, well, I've heard about these oral appliances, but I'm petrified of having my mouth locked together. Do you have anything that allows me to open my mouth easily? And I said, as a matter of fact, I do. And I showed them a device that would allow them to open their mouth easily. So we have to meet our patients where they are. Now, we're scientists and we're doctors, so we have to also make sure we give them a device that's going to be effective. So we don't let an initial bias stop us from thinking, wow, if this person rolls over on their back and they have terrible apnea on their back, well, I have a device that'll make sure their jaw doesn't fall backwards by connecting it with a little hook to the front, to the upper teeth, like a dream tap. I have another device choice that has wings on the side that aren't really connected at all, and the lower jaw can slide right off those wings and end up causing a problem for the airway. So which one would I choose if I have a patient whose sleep test shows us that their breathing is much worse on their back? It would be the one that hooks in the front. So we have to use the effective appliances as well. Now, the dorsal designs, there's a bunch of them out there. They're not bad devices. They can work for lots of people, but you have to be careful to understand the nuances of a few appliances. When I teach the course, it's about the workshop course where I talk about all these different appliances. I make sure we talk about different nuances of each one because each one is applicable to an individual group of patients. We don't have a universal device. There is no device that works for everybody anywhere on the marketplace at this point.
Got it. Thank you for that. How do you initiate the conversation or the discussion about the importance of nasal breathing?
Well, one thing you can do is you can say, especially to a kid, but even to an adult, especially if you notice some mouth breathing, put your lips together and breathe through your nose for 3 minutes. If you can breathe through your nose for 3 minutes without strain, Well, that's one thing. If you can't do that, that's another thing. And then the other thing I always tell patients is if you have any allergies, if you know that you have any breathing issues, then just try this nasal spray. It's super easy. It's not expensive. It doesn't cause any problems. The other thing we do is when the patients come in and say, well, you know, I'm still snoring. I'm having trouble with this. It's not working for me. Say, okay, we've tried the most non-invasive thing we can do, which is holding your jaw forward. Now we got to step it up just a wee bit and give you a medication like a nasal quart to use and a spray. So we're going to make your life just a little bit more complicated by asking you to spray this in your nose every night. So we ease up the ladder as we help the patient see that it takes a while sometimes to resolve all of these sleep-related breathing disorders. It's not an overnight thing anyway. They didn't get to be a bad breather last night. They're not going to be a great breather tomorrow night after you deliver your appliance today. It's going to take a while for the body to reset. So you have a chance to work with your patient to find out what's best for them. Dr. Pankey said this a long time ago. He said, you got to get to know your patient and allow them to tell you what's going on. You have to know your works, you know how to apply your knowledge, know which devices you can use and which tools are at your fingertips. And you apply your knowledge by giving the patient what seems to be the right thing for them at the right time. Not always a formula, not always, it's a thinking person's game.
Got it. Speaking of a thinking person's game, when is it time to refer out to an ENT for turbinate surgery?
When they just can't get their nose to work as well as it should, or if you take, say, a cone beam, for example, and it says, well, this is completely plugged. Well, you're fighting uphill if you think you're going to fix the oral pharynx if they can't breathe through their nose because the turbinates are just giant. And they don't take out turbinates anymore. They just shrink them.
Yeah. Well, gosh, I think we got all of them here.
Great.
Yeah, we did. Steve, thank you so much. Any parting nuggets?
No, just doctors dentists be good doctors. Don't limit yourself to what you think you're supposed to do with the oral cavity. Do a great job there because we're the only ones that can do a great job in the oral cavity. But we also need to help our patients by not having them be nasal disuse patients. We got to make sure they can breathe well. We got to work with our otolaryngology colleagues, our sleep medicine colleagues, our primary care doctor colleagues to make sure that we're really being part of a good team. No one part of healthcare can fix sleep-related breathing disorders all by itself. No one. So we always have to work in combination with our colleagues, and so that's fun. Though it's part of the professional challenge. It is the delivery of sleep apnea care. So good for you. Thank you for being here. I appreciate your time, and I love doing this. There's my email address. Please email me with questions. I love to answer questions and help you out.
Yeah, and I will say, guys, I saw one other question come in about the books, the list of books, Steve, that you mentioned. If somebody emails you here, you could, oh, here we go. We're going back to the slide. Good.
That's just 3 of them. And don't forget Sleep Wrecked Kids. Sleep Wrecked Kids. Everybody needs that book.
Sleep Wrecked Kids. Awesome. Yep. And I'll give one last shout out to Airway Management. We appreciate you guys for sponsoring this. And guys, if you learned a lot tonight, show some love on social media or however you do that. Thank them for tonight. And it's been a blessing and a privilege being with you. So if we can serve you or answer any questions, let us know.
Thanks, Mike. This was fun. Appreciate it.
Have a good night.
Bye.